Gentleman yields back. Recognize Mr. Crenshaw, 5 minutes.
Thank you, Mr. Chairman. So I want to focus on the CDC's role and the notion that it's trying to do too much. I brought this up with the CDC director at our last hearing on the subject, and if you try to do too much, you end up really doing nothing. I'm not the only one who thinks this. Former FDA Commissioner Scott Gottlieb is calling for a smaller targeted agency. President Obama's CDC director, Tom Friedman, calling for a culture focused less on publishing academic papers and more on nimble action. That makes a lot of sense to most Americans. I think they view the CDC as the people who go out and quickly address a communicable disease that is new and novel and dangerous. I think that's what Americans think, right? It's supposed to be an operational organization. That's certainly what I believe it should be. And yet there's massive overlap. The GAO study continues, since 2010, they've been mandated by Congress to annually report on federal activity duplication. To name a few in the CDC, I mean, the substance abuse elements of the CDC mirror the Substance Abuse and Mental Health Services Administration. So there's a whole administration for that. We have to really ask, why is the CDC doing that? Chronic disease programs in the CDC parallel similar institutes at the centers, at National Institutes of Health. Why? What extra benefit is there? We have to be asking those questions and asking about resource allocation. I'd rather the CDC is really good at getting into the field and doing what needs to be done to stop a communicable disease. It gets worse than that because then the CDC is also publishing things like the Health Equity Guideline Principles for Inclusive Communication, saying drug users shouldn't be called drug users, they should be called people who inject drugs. Person who relapsed shouldn't be called that, they should be person who returned to use. Can't call somebody a smoker, got to call them people who smoke. That's weird. Also, why is anyone spending time on this? Why is anyone at the CDC spending time on speech codes? That forces the public to lose trust in a very important organization. It keeps going. I mean, there's another document called Racism is a Serious Threat to the Public's Health. I mean, nobody likes racism, but again, is it a communicable disease? And how so? And if there's structural racism, like is there a specific structure that the CDC has targeted to stop racism? Anybody? I can't imagine there is. I'm not really sure it's your job. There's been a lot of calls for the CDC to investigate gun violence. I'll tell you what, there's already an agency that does that full time. It's called the police. They investigate crimes. They stop gun violence. There's this really crazy data out there, and it goes like this. When there's more police doing their jobs, there's less crime. When there's less police, when they get defunded, there's more crime. I did all your research for you. It's done. It's that simple because we have common sense. There are things the CDC needs to be doing, and so I want to end on a positive note. One thing I do like that the CDC has talked about is investigating fentanyl wastewater. Now that's the kind of thing we should be doing. That's in the field, and it's actually focusing on a problem that Americans have. And with that kind of data, yeah, you could focus on problem areas that are dealing with fentanyl. Love that. So I'll end with that question. I suppose it's for Dr. Layden. Do you have any updates on CDC's inquiry into this area of research and whether you can do a pilot project testing it in key areas?
So thanks for the question. I'm going to actually yield to my colleagues, Dr. Alworthy.
Okay.
So the Injury Center, a lot of our work related to substance use is about field-driven response. And actually, there have been more. They're called epi-aids when states or locals are requesting help on the ground for an urgent public health threat. There have actually been more from the Injury Center than from any of the rest of CDC in the first 6 months of the year. We've had 7 of those responses. One of those was related to looking to understand more about using wastewater to better understand how to respond respond to the opioid crisis. I will tell you, it is a space that we are still very much learning in. We don't have the ability at this point, for example, to differentiate between prescribed opioids or illicit opioids. And it's really important, though, that the work of the data work related to substance use.
That's interesting. So, but you can specifically detect fentanyl versus OxyContin. Is that accurate?
Yes. So say fentanyl is used appropriately in a hospital situation, that can't be differentiated.
Understood, yeah. But you can at least create hotspots of where there's higher use of fentanyl in the wastewater, right? Whether it's legal or illegal.
So this is exactly what we're looking into, and we've sent teams in the last few months out into communities that are exploring this. It's early technology, but I appreciate your point of needing to make sure that we have the data to understand this problem, and it is the CDC and the Injury Center where the data work to understand the overdose problem lives, and that's why part of why CDC is focused on it.
I appreciate that. I think, and I bring it up as one of the things the CDC should be doing, unlike a lot of the other things I mentioned. So appreciate that, and I yield back.
Gentleman yields back, recognized